Definition: a bladder tube is a very thin tube that is used to help in the expulsion of urine. The tube is inserted into the urethra to reach the bladder and thus allows continuous drainage of urine. There are two types of proofs. Intermittent: when the patient has urinary incontinence and incomplete emptying of the bladder produced by neurological damage to the nerves that control urination or any other cause. The hole can be made by the patient himself, self-proof, or by the patient's caregiver. This type of bladder tube will be used depending on the volume of urine secreted as well as the capacity of the patient bladder. Permanent: when the catheter is fixed to the bladder with an air-filled balloon or other fixation device. It is used mainly in patients who have undergone surgery to control the amount of urine secreted or for maneuvers of continuous bladder drainage. In this case, the installation of the probe requires the intervention of qualified health personnel.
Characteristics: can be latex, silicone, or polyvinyl nylon. Your measures vary according to sex. Women 14 to 16F and 16 to 18F males. Depending on the indication, it can be of other types such as co-bladder or Timon. They usually have two trolley legs, one to drain urine outside, another to inflate a bladder or valve, and another to install a washing serum.
Performing: the purpose for which the tool is used every inch can be used, as we have detailed and vague visions to facilitate the expulsion of urinary to control the receipt, amount of urinary and specific type, to train intraoperative, postoperative, and certain surgical operations. In cases of genital sores, proper hygiene is monitored for the treatment of chronic diseases in which there is difficulty in urinating. The means for use indication for placing probe: acute or chronic urinary retention, prostatic hyperplasia, drainage of an atonic bladder, the foreign pelvic surgery in patients with urologic surgery, patients in postoperative stage, to measure urinary volume, obtain your contaminated urinary nylon probe, bladder and things during delivery nylon probe, irrigate the bladder, studied in genitourinary tract, for the management of urinary incontinence.
Warnings: complication, the abuse, a problem, allergy, or sensitivity to light, bladder sound, blood infection, blood in the urine, kidney damage, urethral session, infections of the urinary or renal tract, bladder cancer, only after prolonged of permanent.
Consult your supplier if you present bladder spasms that do not disappear, bleeding into or around the group, fever or chills, escape of large amounts of urine around the tube, skin ulcers around a suprapubic tube, calculation or sediment in the bladder, catheter or drainage bag, inflammation of the urethra around the catheter, urine in the strong odor or that is thick or cloudy.